and James are from LifeLong. Would you all mind giving a quick introduction to yourself and the organization?
You can go first.
Hi, so I'm James Snell. I'm the volunteer coordinator at LifeLong. So I work with all of our individual volunteers, getting them onboarded. Our mission is to ensure that vulnerable and marginalized people thrive by eliminating barriers to health and wellness. We were established in the mid-1980s at the height of the AIDS/HIV epidemic. And we really just came out of community members wanting to better support one another, at first through food and medicine, but now we have 13 programs all across the spectrum of health and wellness.
And my name is Tara Jacobson. I am the Community Engagement Coordinator. So like I always say, I do just that. I engage our community. So I work primarily with our corporate partners and our community groups to support all the different LifeLong programs, both on-site at our LifeLong offices, and then also in their own communities to help further the mission of LifeLong.
Thank you for giving some context to what you all do at LifeLong and what LifeLong does altogether. So we are in the midst of one of the most unusual times. What is LifeLong doing to cope with COVID-19?
So we've adjusted our programs quite a bit. We have a daily professional cleaning service coming in. All staff that can work remotely are now working remotely. That includes most of our office workers. So our offices in Everett have about one staff member up there. At Pike, we have an office that has one staff member there. We have started reducing all of our volunteer shifts numbers wise. So we have a maximum of 5 volunteers per shift per program. And we've implemented a pretty stringent sanitation. I'm not sure the word there.
Yes, sanitizing everything.
But you're still providing have your services remained constant?
Yeah, so our services are still being provided. The programs that can do services over the phone are doing so. So that's like our insurance programs doing that. But a lot of our volunteers work with our Chicken Soup Brigade. That's our food as medicine program. So the staff members and volunteers that work with CSB are still working on site. We're just making sure we're sanitizing everything more frequently.
Yeah, and I think the only thing that's a great explanation, the only thing I would add to it as well is that our focus as a volunteer department has really shifted. In the past or in a typical year, we really support a few other different LifeLong programs, our prevention team, a lot of admin, special events, and right now we're just focusing on the Chicken Soup Brigade to make sure, because this is a really essential function that our clients need. So that is currently our only focus, and we're really trying to best support that program.
Yep, we've even increased the amount of clients that we're serving. So
yes,
it's been really neat.
Oh, wow.
Yes, and it's increasing every week. It feels like, there's definitely a lot of other organizations who have been reaching out to us, and our different funding and grant partners are trying to see what we're able to do to better support or to more fully support the community.
Yeah. Is there anything that you would like people to know about what is happening at LifeLong currently?
I just think, I think the first thought that came to my mind is how grateful that we've been. I think James and I were actually talking last week just about the amount of people who have really come to our community aid and really want to support us. The thing that I just keep getting, even we've been really busy, but the thing that I've been getting is, how can I help? And I think that's just been really wonderful. And we actually, kind of going back to your other question, we've changed a little bit more of our process to really better support volunteers during this pandemic, and really focusing more on the shorter term to kind of get through and really help our programs. And so we've just really been so grateful with the support that we've gotten from volunteers who have come on site, from folks who have been doing things off site, like assembling grocery bags or making well-wish notes, and even for our volunteers who have decided to take care of their own health. We're just so appreciative of all of our support. We have a really great community here.
You nailed it.
That's great. Are there any like really specific ways that you all are accepting support, volunteer, whether that's like directly or virtual, or what anyone can do from where they are?
Yeah, so we opened up a new application process for emergency COVID-19 volunteers. So they can find that at our website. It would be lifelong.org/volunteer. We also have offsite opportunities listed there. So we have a lot of really neat groups we work with that aren't able to come in right now. They're making well-wish notes for our clients, as well as doing double bagging for our grocery bags that go out to clients every week. And we've really just seen that the community step up and come to our aid. We've, of course, like most organizations, lost a lot of our regular volunteers just because they're either needing to self-isolate for whatever reason. But we've had more than enough people come in to step in and fill those roles, which has been super sweet.
Yeah, that leads us to the next question, which is if you have any uplifting stories to share or a message of hope for folks who tuned into this.
Well, actually, I was just telling James that today we actually received a donation from one of our community partners of 90 pounds of shelf-stabled items that they collected. So we work with a male rugby team called the Quake Rugby Team, and they knew that we were in need of food items, so they came together and collected these and were able to get them for us. So 90 pounds will definitely go a long way. And yeah, I just feel like that's a story that we've just been hearing over and over again, just of people really doing what they can and having it make such a big impact.
For sure. Yeah. Normally we get about 20 to 40 volunteer applications a month. This month we have over 170.
Oh my gosh.
Yes.
So.
That's awesome.
And I want to say that James has been phenomenal in that. I don't know if you can put that in too, but he's been so great. I can't even imagine one human doing all that, and he's been doing it. So
thank you.
Oh. We'll make sure that fits in. I'll shout out to James.
Okay, good. Yeah. Anytime I can, just a little shout out.
Thank you guys so much for taking the time to chat with us. I know that everyone, it's a time where just looking for connection and in creative ways, and however we can do that. So do you have any final thoughts before we wrap up?
Just say anyone watching this that's trying to get involved in the community, feel free to reach out to us. And there's also a lot of need at food banks for volunteers right now. So check out whichever one's closest to you, and I can tell you they're definitely wanting your help.
I think the only thing I've been really trying to think of is that we're all not alone in this, and we're all together. And I know that it's been really hard for some people who need to self-isolate or be in quarantine, but there are definitely ways that you can get involved. And I think just even helping in the little way you do can make a really big impact. So
great. Thank you so much for your time. It was great to see you. Hopefully we'll be seeing you in real life soon. Yes. Take care.
Okay. Thanks.
Thank you.
Bye.
Bye.